Welcome to the American Red Cross's Respiratory Protection Training for COVID-19. This program complies with the OSHA 29 CFR 1910.134 Respiratory Protection Standard. The purpose of this respiratory protection program is to establish procedures to ensure the protection of all American Red Cross employees from respiratory hazards through selection and use of respirators. The Respiratory Protection Program can be found on Safety's Exchange page under the General Safety Topic Hub, or you can follow the link below. Before I discuss respirators, I want to focus on prevention. It is important to recognize that the optimal way to prevent airborne transmission is to use a combination of interventions from across the hierarchy of controls, not just PPE alone. The best way to prevent illness is to avoid being exposed to the virus. However, as a reminder, the CDC always recommends everyday preventative actions, such as hand washing, to help prevent the spread of respiratory diseases. The American Red Cross will identify and evaluate the respiratory hazards in the workplace. This evaluation shall include a reasonable estimate of employee exposures to respiratory hazards and an identification of the contaminant's chemical state and physical form. For the purposes of this training, we will be focusing solely on the N95 respirator. An N95 respirator is a respiratory protective device designed to achieve a very close facial fit and very efficient filtration of airborne particles. The N95 destination means that when subjected to careful testing, the respirator blocks at least 95% of very small test particles. If properly fitted, the filtration capabilities of an N95 respirator exceeds those of a face mask.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to show you how to don and doff an N95 mask, also called a respirator. So to don the mask, you're going to take the mask and cup it in your hand, letting the straps dangle slightly. Then you're going to take the mask and cup it around your nose and your mouth, just like this. Then you're going to take the top part of the mask and form it around the bridge of your nose. Then you're going to take the top strap of the mask and put it at the top of the head. Then take the bottom strap and pull it to the base of the neck so it rests at the bottom of your neck like so. After that, make sure that the mask is tucked underneath your chin, and again the clip is formed around your nose, and perform a seal check by blowing and seeing if you feel any air leakage up at the top or at the bottom of your mask. Okay, now whenever you're ready to doff the mask, what you're going to do is you're going to take both of your fingers and you're going to move the bottom strap first and slightly lean your head forward. So remove the bottom strap slowly but carefully, being careful not to touch the front of the mask because it's contaminated. Then you're going to remove the top strap like so, and then discard your mask. Okay, so that wraps up this video on how to don and doff an N95 mask.
One consideration with an N95 respirator is facial hair. Facial hair that lies along the ceiling area of a respirator, such as beards, sideburns, mustaches, or even stubble, should not be permitted on employees who are required to wear the respirators that rely on tight face piece fit. The notice warns that facial hair growing in or protruding into the area of the primary sealing surfaces of a respirator will prevent a good seal. The following chart from the CDC will illustrate which facial hairstyles will and will not work with an N95 respirator. Supplies of N95 respirators can become depleted during an influenza pandemic or widespread outbreaks of other infectious respiratory illnesses. Existing CDC guidelines recommend a combination of approaches to conserve supplies while safeguarding healthcare workers in such circumstances, such as extended use and reuse of the N95 respirators. The guidance below will help to limit potential N95 respirator surface contamination. Use a cleanable face shield over an N95 respirator to reduce surface contamination of the respirator. Hang used respirators in a designated storage area or keep them in a clean, breathable container such as a paper bag between uses. To minimize potential cross-contamination, store respirators so that they do not touch each other and the person using the respirator is clearly identified. Clean hands with soap and water or an alcohol-based hand sanitizer before and after touching or adjusting the respirator. Avoid touching the inside of the respirator. If inadvertent contact is made with the inside of the respirator, perform hand hygiene as described above. Use a pair of clean gloves when donning a used N95 respirator and when performing a user seal check. Discard the gloves after the N95 respirator is donned and any adjustments are made to ensure that the respirator is sitting comfortably on your face with a good seal. Discard any respirator that is obviously damaged, contaminated, or becoming hard to breathe through. For more detailed guidance, follow this link to the CDC's website. If you have a pre-existing medical condition, wearing a mask may make breathing more difficult because you must pull air through the mask as you inhale. People with known or suspected breathing problems, emphysema, chronic obstructive pulmonary disease or COPD, asthma, or cardiopulmonary problems should consult with their physician before using one. If at any time during the use of the mask you experience headache, nausea, dizziness, or have difficulty breathing, immediately leave the area, remove the mask, get fresh air, and seek medical attention if necessary.